or have services through children and youth, but also our mental health and intellectual developmental disabilities. The cases require very specific services that are not always available. And if children cannot remain in their home, they are required to be placed in specialized settings with few children and special one-on-one services. And again, there are very few options of these across the state. Although these cases can be difficult, I will say we're fortunate here in Cumberland County because I have a strong collaboration with Annie and Sue, and we meet on a regular basis to try to break down the systemic issues and how to help our families move forward. Our other challenge is staff turnover. And this is not an isolated issue for Cumberland County. In speaking with many administrators across Pennsylvania, everyone is being impacted by the turnover and the decrease in people coming out of colleges with social work as their career path. This past fiscal year, our turnover rate was 22%. 4 staff left under 6 months of time being with us, and 7 left with under 2 years. I do exit interviews with everyone when they leave. And again, the number one thing that people highlight is stress of the job. Some of the staff were hired during COVID, and I do believe that had an impact. Considering we were all doing everything remote, we didn't build those strong relationships with new hires because of that. This past year, we were able to add 2 quality assurance workers, and their main goal was to develop an onboarding process. And we're hoping, and then these 2 workers will work collaboratively with the supervisor to help train and then support new staff. So we're really hoping that now that we've got that up and running, we're going to see some improvement with our turnover. The other part of our needs-based budget is projecting for our future needs. And we are requesting the addition of 3 staff, a supervisor, a caseworker 3, and a caseworker 2. We asked, as you guys know, we asked for these positions in our state budget, but before we would create any positions, they'd come before the Board of Commissioners. So now I'm going to let Lisa just highlight the fiscal side of our budget.
Good morning, Commissioners. I sent a copy of our budget summary. I just want to point out that the first column is fiscal year 2021. That's the fiscal year that just ended. We are not overmatched this fiscal or that fiscal year that just ended. And actually our spending was below the prior fiscal year 1920, and that was due to COVID. We were about $150,000 less. And due to that, that made budgeting for our current year and our needs-based year a little bit easier. The second column, which is fiscal year 21-22, which we are currently in, it looks like it's a big increase from fiscal year 2021, and that's because the state already certified us for fiscal year 21-22. So I wanted to remain at those levels because the state had already certified us. I don't anticipate we'll get up to that level, but it's there if we need it. And I definitely don't believe we will be an overmatch in the current fiscal year. And then our third column is our needs-based year. And as always, I call that our wish list year. But because there was such a big gap between fiscal year 2021 and 21-22, we didn't ask for any big increases in that fiscal year. It's just the normal salary increases and benefits. There is one thing that I do want to point out that changed in this fiscal year that we are currently in, and it's the implementation of Families First Prevention and Services Act that will become effective October 1st of 2021. A couple of changes that come with this Families First Prevention Act is that it'll change our Title IV-E federal revenue. And there's 2 ways it'll change the revenue. One is that when we have eligible candidates that are eligible for in-home services, we are now able to collect Title IV-E revenue for any services that are an evidence-based and approved and on the clearinghouse. We don't have a lot of those right now, but the state is working to build upon those. The second is our congregate care placements. The way that our Title IV-E revenue is affected here is that we will only be allowed to claim for the first 14 days of a child's placement in a congregate care. It may seem like a lot of revenue that we'll be losing in this respect, but in Cumberland County, we have a small number of children that are placed in congregate care placements. We currently have 16 kids in congregate care, and only 4 of those are Title 40 eligible. So it's not like we'll lose a lot of revenue because of these placements. We typically might only have 4 to 6 children in a fiscal year. Also, and as you probably are aware, when Jamie Reiber comes before you with contracts, you may be seeing a lot of increases, significant increases in congregate care providers. That's because they're becoming specialized settings. And when they become a specialized setting, their per diem significantly increases. But a good thing is if we do put a child there and they are 40 eligible, we'll be collecting more 40 revenue because they will be eligible for the entire placement if they're placed in a specialized settings. So that's just a change. We'll have to see after we go through a fiscal year or two to see how it really does affect us, but I don't think it'll be a huge effect. And that's all I have. And then the second page is the graph that I usually provide. And this just shows how that our state, federal, and county revenues increase over the years or decrease. And county share typically stays around between 16.8 and maybe 17.1 or 17.2. Are there any questions?
I have none, thank you.
All right, thank you both for the
Thank you.
explanation. All right, we'll move on. We'll move on then to agenda item number 6. And I'll call on Dana Best to discuss resolution 2021-24.
Good morning. The Human Service Development Fund is increasing revenues and expenses by $2,413. Subsidy is increasing due to an increase in the indirect costs. Any questions?
No.
Okay, so I'll ask Dana also to discuss agenda item number 7, which is Cumberland County's cost allocation plan. Dana? You're muted.
It must have automatically muted me. Sorry. Finance is requesting approval to accept the 2020 cost allocation plan prepared by Maximus to be used in the calendar year 2022. The cost allocation plan is used to charge back costs to departments in order to maximize federal and state funding.
Any questions for Dana? All right, thank you very much, Dana. I'm going to go ahead for agenda item number 8, turn the meeting over to Tammy Hershey. Tammy?
Thank you, Stacy. Agenda item number 8 is contracts and grants. Number 8, numeral 1, there are none. So we will move on to agenda item 8, numeral 2, A through H, which consists of new contracts, vendors, services, grants, and contracts with increases or decreases to the county. I will begin by calling on Kim Bittner to discuss the contracts for aging and community services. Kim.
Hi, good morning. Center for Independent Living is for personal care and home support for eligible seniors. The Adams County Aging, Harrisburg YMCA, Contact Helpline, they're all for pass-through funding for ADRC services, which is Aging and Disability Resource Centers. Menno Haven is for senior center services, domestic violence for emergency shelter services. Central PA Food Bank is the wholesale distributor for our food pantries in the state food purchase program. And the last one, Center for Independent Living, is also pass-through funding for the Aging and Disability Resource Centers. Any questions?
No.
All right, thank you, Kim.
Thank you.
Next, I will call on Jamie Reiber to discuss the contract for children and youth.
Thank you. Good morning, commissioners. This is a contract for Hmrf, Pennsylvania. They provide foster care services for our agency. They actually are not increasing any of their programs this year. However, they are decreasing 3 levels of care because of the maximum allowable that the state has approved for them. So we're reducing 3 of their rates between just under 0.5% and almost 8% for those 3 different levels. And we are also adding an additional level of care. We have a similar level of care, however, the placement maintenance, which is the amount that goes to the foster parents, is increasing in that particular level.
Okay, any questions for Jamie?
Thank you.
Thank you. Okay, next I will move on to contracts under the commissioners. I will review first the one for the Housing Authority of Cumberland County. This contract is for the Housing Authority to be the administrator of the ERAP2 grant in the amount of $5,973, $973,600.09 for the county. And do you have any questions for that, Commissioner, that I could answer for you? The second one is with HRG. It is an addendum. This particular addendum is a change order to the contract in the amount of $5,282.97, which will cover the placement of corner markers and some finalization of the subdivision plan that is being done for work in conjunction with CNRC. Any questions about this change order, Commissioners?
No.
Thank you. All right, I would like to now call on Jack Carroll with Drug and Alcohol to discuss the 2 contracts. Jack?
Thank you, Tammy. Good morning, Commissioners. We have 2 contracts for your consideration. Both of these are continuation contracts, but they do involve rate increases. The first is with Here Incorporated, which is the name of the company that operates the Gatehouse halfway houses. They operate 3 halfway houses located in Lancaster County, and 2 of those are for men and 1 is for women. One of the halfway houses is receiving a 6% increase in rates, another a 4% increase, and the third a 3% increase. I think our fiscal officer, Ryan, probably provided you with a spreadsheet breaking down these increases. So that is the Gatehouse contract. And then the other contract is with Eagleville Hospital. That's located in Montgomery County. Although they are a hospital, they provide both hospital-based and non-hospital detox and rehab services for us. There is no increase in the per diem rate for their hospital detox and rehab services. There is a 10% increase in their rates for non-hospital services, detox, rehab, and rehab for individuals with co-occurring substance use disorders and mental health disorders. Each of those contracts have a 10% increase. Those rates are set through a statewide rate setting process, and Eagleville has identified the state's new requirements to align with the American Society of Addiction Medicine diagnostic and placement criteria as the reason for those increases. The alignment requires them to increase the number of therapeutic hours in non-hospital settings. That translates into hiring more clinical staff. So that's what they're attributing the 10% increase to. Are there any questions?
None? All right, thank you, Jack. I will now call on Kirk Stoner to discuss the contract for liquid fuels along with the 2 contracts for planning. Kirk?
Good morning, Commissioners. The first contract addendum is with HRG. It's their National Bridge Inspection Program that they manage on our behalf. PennDOT has expanded our list of bridges that need inspected to include several of our newly constructed bridges. as well as additional inspections for our priority one items that we find during our inspection. So priority ones require more frequent inspections. For instance, some of our steel truss bridges that require 3-month inspections versus an annual inspection. Total cost is $60,000, $60,397. Our share of that is 20%. We have it budgeted and planned for in our bridge capital improvement plan.
Any questions on that?
Okay, so Tammy, you want me to do the next two then?
Yes, please.
Okay, thank you. So the next two then are Cumberland Plans Planning Grants. The first one is South Middleton Township. This is simply the contract for their $15,000 Cumberland Plans grant to do planning for the Carlisle Airport, which they're looking at ownership of. So this was previously approved. The grant was previously approved. Now we have the contract that we need to sign off on. And the second one is an addendum request from Mount Holly Springs Borough. We had a $6,500 grant with them to codify their ordinances into a nice online platform. Got through the process and they had some additional costs with that project. And they were asking if they could come back for an addendum of $2,275.50 to help out with the project. We do have cost savings on some projects from 2018 that we could apply to this. Our grant committee from the Planning Commission looked at it and recommended approval of it. And we're sending it now to the Board of Commissioners for your review.
Any questions for Kirk, commissioners?
So Kirk, the costs that are driving this are in line?
Yeah, Terry, I believe they're reasonable.
Okay. All right. That's all I have. Thanks.
All right. All right. Thank you, Kirk.
You're welcome.
All right. At the moment, Sue is not on the call to go over MHIDD, so I would like to move on.
Tammy, I just want to let you know, she's going to be calling in.
Okay, she will be. Very
So
good.
I think your plan is a good one, but I just want to let you know that by the time we'll be able to go back to her.
Oh,
She'll be
great.
on.
Thank you, Stacy. So if I can move on to Claudia, please, to cover public safety.
Good morning, everyone. Can you hear me okay?
Yes.
Okay, thank you. The first grant we have is the Hmrf grant, the Hazardous Materials Response Fund grant for state fiscal year 21-22 in the amount of $41,172. This is an increase of $182 from the previous grant year. This is utilized for our hazardous materials team and their emergency response capabilities for all the SARA facilities and any type of hazardous emergencies that would occur in the county. And it has a performance period of July 1, 21 through June 30, 21. The second grant is the RER, Radiological Emergency Response Grant for state fiscal year 21-22 in the amount of $21,489. This is a slight decrease of $629 from the previous year. This has a performance period of July 1, 21 through June 30, 22 as well. And that is mostly to cover any emergency responses for TMI. So this will likely be our last grant year for this. Do you have any questions?
All right. Thank you, Claudia.
Thank you.
Is Sue on the call at this time?
It doesn't look like she's gotten dialed in yet.
Okay. Would you,
Maybe
like
we
to-
can just come back to her agenda items once she's gotten phoned in.
all right, thank you, Stacy.
Okay. All right, so we'll move on to, sorry, I've got to move all my papers aside here. We'll move on then to agenda item number 9. And again, we'll come back to agenda item 8F once we have Sue available for us. So agenda item number 9, I'm going to call on Travis Shank to discuss a request to provide prison staff with a $10 gift certificate donation. Travis.
Good morning, Commissioners. Destination Carlisle has made a generous offer of gift cards to the staff at CCP. The amount of the card is $10. It's under the amount allowed by the county under the gift policy, but due to it being collectively 122 employees, it is over the policy. I'm asking that the BOC consider allowing these cards to be accepted.
Any questions
Assume
Travis.
solicitors already given an okay on that.
Yes.
Okay, then I will reach out to them, Stacy, and let them.
Okay. That sounds
Travis,
like
this
good.
doesn't need action today, right? It can wait till Monday.
Yes, it can. It
All
can.
right, thank you.
Thank you, sir.
Okay. Thank you for that clarification, Commissioner. Yeah, so we'll take action on that on Monday, and then we'll be able to contact
You
Destination.
got it. Thank you.
All right, we'll move on then to agenda item number 10, and I'll call on Solicitor Brenneman to discuss a letter regarding a crematory in Cumberland County.
Good morning, Commissioners. This is a request by Musselman Funeral Home and Cremation Services to operate a crematory at its location. And under the state law, particularly that's governed by DEP, the operator of a proposed crematory needs to have a letter of approval from both the municipality in which the crematory is to be located, indicating it's consistent with its zoning ordinance and comprehensive plan, and also from the county in terms of whether the use is consistent with the county comprehensive plan. And in consultation with Mr. Stoner, he confirmed that it is in fact consistent with the county's comprehensive plan. So on that basis, I would recommend that a letter of support be issued for the benefit of Musselman Funeral Home and Cremation Services.
Is the borough waiting on that?
I don't know if the borough has issued a letter, but I know that the funeral director at Musselman has indicated that at least the county's letter is an item that's needed in order to have this matter concluded. If the borough does not issue such a letter, then there's going to be an issue that the funeral home will have at DEP.
Okay.
Keith, the borough will have final say on approval. Our letter is just stating that it says it's okay in the comp plan. It's not necessarily say we favor what they're doing, correct?
That's exactly right.
I have no issues with that.
That's fine.
Any other questions for the solicitor? All right, thank you very much. We'll move on then to agenda item number 11, which is Commissioner's liaison reports, and I'll start by calling on Commissioner Eichelberger.
Sure. Not a whole lot here, but the stuff I have is important, I guess. The liaison activity I'm doing right now is mostly related to CADIC as well as Workforce Investment Board. So we have a meeting set up, I believe, next week, so that the CADIC board chair and I will be meeting with Jesse McCree at Workforce at the South Central PA Works. And that's to discuss some strategic directions. It's also going to be a little bit of brainstorming on organizational matters, as you know from previous reports. We're looking to do more partnering with them on workforce development issues. In case you weren't aware, Laura Potoff has issued her resignation. She's taking another position, and so we're going to have to reset a little bit there because she was dealing directly with Jesse on some of these issues, and so that's all going to be developing in the near term. And also, CADIC is undertaking. You may recall this was discussed before. They're undertaking something of an organizational review. They're doing their interviews this week with some folks who will help them look at the existing positions and the work responsibilities and such. Now that, of course, Valerie left to go work for Cumberland, as well as Laura, and provides an opportunity for us to answer some questions we had that came out of the strategic planning process in regards to making the most efficient use of the resources we have. So those interviews are going on this week. I'm not part of I was invited, but I just don't have time to do them, so I'm not part of that. But we'll be coming back to the board of directors with a recommendation on that eventually, and then they'll get that underway. So management changes continue over at CADIC. Some directional issues driven by COVID continue to be formulated. So we got our hands full with quite a bit of work there. That's all I have.
Thank you, Commissioner Eichelberger. Commissioner Fauci.
Good morning, everyone. I have a very brief update. Yesterday, I attended the Reentry Coalition Task Force meeting. Boy, that group is really moving forward in such a nice way. Yesterday, they worked on their mission and vision statement and passed those things. So I'm excited to see the work that the Reentry Coalition is doing. And I would remind everyone to use the library. And finally, I was very glad that Jane Sheffield was here this morning to talk about the September 11th National Memorial Trail Alliance. I think that will be very good for Cumberland County. Ms. Sheffield came to the Planning Commission to talk about that. And it is my understanding that our support of the Trail Alliance will also allow us to receive some different types of federal funds in Cumberland County for trails. And that's all I have. Thank you.
Thank you, Commissioner. Commissioner DeFilippo.
Yeah, Stacy, I have two updates. One's for the Housing and Redevelopment Authority and also the Conservation District. However, they are on a document that I cannot access right now due to the fact that our VPN is not working. So as soon as I'm able to access that, I will send a copy to my colleagues ASAP, which hopefully will be later today.
Thank you. I would like now to return to agenda item number 8, and I'm going to call on Annie Streitz, who is here on my cell phone. We'll see if we can get this to work. Okay, you're on, Annie.
All right, thank you. Good morning, everyone. Sorry for all the hiccups with technology this morning. So I have 4 contracts to go over with you, commissioners. The first being one of our IB contracts from actually fiscal year 2021. It's one of our residential providers with Keystone Service Systems, and it's an additional $3,847. So the total contract was just about $106,105,905. The second contract was actually with the International Service Center, and this is for this current fiscal year 21-22, and they provide language interpretation for our early intervention staff. The total contract is $5,000. The third contract is with our jail, Cumberland County Prison, and it is for this current fiscal year 21-22, and it is for half of the salary and benefits of the prison counselor position. So the total contract is $39,521. It's actually a slight increase of $1,365. The final contract is for York County Transportation, so Rapid Transit, and it's for the IDD side of our office, and it is for the current fiscal year 21-22, and it's a decrease of $4,440. Of course, they provide transportation for individuals with intellectual disabilities, and their total contract is $67,594. Do any of you have any questions for me?
Annie, I do. I'm wondering why the decrease in the Rapid Transit, please?
I think in part because at this point, there are many families who are still concerned about having their loved ones travel in congregate settings. So I know Rapid Transit is actually trying to increase ridership, and the Office of Developmental Programs still has some of the programs closed, or at least using a limited amount of people because of social distancing. So they're really trying to be vigilant about not passing the virus. So I think that ODP is slowly opening things up, but there are also lots of families who are hesitant to send their loved ones out.
Okay, thanks, Annie. I hate that people aren't receiving those services, but maybe that will improve as time goes on here.
We certainly hope, yes.
Okay, thank you.
Any other questions?
Any other questions?
Thanks, Annie. Okay, It doesn't look like there are any other questions. Thanks to Sue and Annie for coordinating with one another and using an ugly but yet effective method to get the information to all of us. We definitely appreciate it.
All right, thank you.
All right, so we'll move on then to agenda item number 12, and I'd like to report that we had executive sessions on August 25, 2021 at 2:30 p.m., September 1st, 2021 at 9:30 a.m., and both were regarding personnel. Moving on, I'd like to ask if anybody has any other business to bring forward today.
Stacy, Vince, just a question. Retirement board, will be at the courthouse.
Yes.
All right, great. Thank you. And also thank you for getting this meeting and the virtual all together under crazy circumstances. Thank you.
It was definitely a team effort and, fine oiled machine here. Team building exercise, that's what it was. Okay, I actually would like to bring other business forward. We had a disaster declaration that was issued yesterday that needs to be affirmed. So I would like to officially request the approval of an agenda item to be added to our agenda to address that disaster declaration. And that will require action today.
I'll move for the addition of the action item.
I'll second that.
And I would like to, I'm
Moved-
sorry.
Yeah, moved and seconded. All in
Yes.
favor, indicate by saying aye.
Aye.
Aye. Motion
Sorry
carries.
to have
Okay.
interrupted.
No,
I would
I
like,
was sorry.
no, that was all on me. I wanted to make sure I did not forget that we do need to make note that the reason for the addition of the agenda item was due to an emergency that occurred after our agenda was officially published.
And Stacy, this is the emergency declaration because of Hurricane Ida?
Yes. So now we can move forward with addressing the disaster, the affirming of the disaster declaration.
Okay.
So, yeah, we need a motion to that regard, affirming it.
I'll move to approve the emergency declaration or to reaffirm the emergency declaration regarding Hurricane Ida.
I'll second.
Moved and seconded. Any questions on this? All in favor, indicate by saying aye.
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 Motion carries unanimously. Thank you, Stacy, for handling that.
Yes. Is there any other business to bring forward today?
No, but Stacy, if you could hang on to Zoom when this meeting is over, please. I'd just like to run something by you quickly.
Sure.
Thanks.
All right. So if there is no additional business to be brought forward, our meeting is adjourned. Thank you, everyone.
Thank you.